Well, good evening, and thank you everybody for joining us at the first Butte Schools Self-Funded Programs Open Enrollment webinar. We've had a number of open enrollment presentations over the years and then videoed at Butte College, but this is the first webinar that I have done. So I appreciate your patience tonight. I've been practicing this process for a little bit, but I think we've got it all squared away, but I hope it's going to go well. So thank you for your patience. I've had a little bit of computer troubles earlier today with my machine kind of spontaneously shutting down. So if that happens, I'll get back on as soon as I can. But we do have a recording of another presentation that I did at Butte College available on our website if something were to happen this evening. In your control panel for the webinar, you can see we have a file transfer library, and you can download a copy of these handouts later, or they also are available at our website, a copy of the presentation if you need those for reference. Throughout the meeting, right now I have everybody on a listen-only mode so that we don't have feedback from everybody else as the dog comes in to give you licks and kisses and the kids need something out of the refrigerator, so that we don't hear background noise from everybody else. But if you do need to ask a question, you can press *6 to unmute your personal phone and ask your question, or you're welcome to type it in the chat area, and I will try and monitor that as I go along in the presentation as well. So with that, let's go ahead and get started. I want to make sure this evening is informative for you, so do ask your questions as you need to, and we'll try and address those as we can. Before we get started too far, I have had a lot of questions regarding incentives that we announced for attending health and wellness education sessions and completing health risk assessments. I can't say that the check is in the mail, but I am in the process of winding up processing all of those. So the check will be in the mail soon. So I really appreciate your patience as I work to get that process completed. I want to spend just a few minutes talking about what the Butte Schools Self-Funded Programs is. We are a special district under the California Government Code, and our membership is comprised of the 14 school districts, the Butte County Office of Education, and Butte College all participate in our program. We're governed by a board of directors just like your school district, but ours are not elected. They are appointed by each of the school districts, so each district has a representative on our board. Currently, we cover almost 4,000 employees and retirees. When you add on spouses and registered domestic partners and their dependents, we take care of about 10,000 belly buttons in our pool. We also are accredited with excellence by the California Association of Joint Powers Authorities since 1994. That hopefully gives you some confidence that although we may be experiencing high increases in our claims, which leads to some increases in our rates, we're doing the best with the best practices and industry trends in our program, and that we're doing the best with the information that we have. We've been around since 1982 taking care of self-funded medical, dental, and vision, and we also do property and liability for many of the districts. Some of the benefits of being a member in the Butte Schools Self-Funded Program is that we pay our own claims, and that as a self-funded group, our plans are designed by our pool locally. Local control is a significant buzzword in public education today, and we are another example of that as we determine our own plans and set our own rates locally. But along that theme, when we do set our own rates, perhaps if we set them a little bit higher than is necessary, those dollars aren't lost and they aren't passed on to Anthem Blue Cross. They are retained here locally and used to offset future increases in the form of rate subsidies. During this open enrollment period, you can find the information you need in the packet given to you by your district or at our open enrollment webpage. All of the BSSP information is available at www.bsspjpa.org. Your district benefits staff has a lot of resources, and they have a lot of information about the plan as well, and it'll be a resource for you. If you have specific questions, you can email my office. The best way to do that is at bssp@bsspjpa.org, or my personal email is at the last slide of this presentation. Right now I'm out of the office every afternoon making presentations like this, and my ability to return phone calls is pretty limited. So I'd encourage you to email me, and if you feel we need to follow it up with a personal phone call, give me a time and a phone number at which I can reach you, because as I mentioned, I'm out of the office many days right now. On the left of the screen you have our open enrollment web page, and if you click on open enrollment information, that will take you to another screen. I'm going to try actually logging on to our live website right now and show you what that looks like. So right now you should be able to see our live web page at bsspjpa.org. You click on the open enrollment information and that will take you to screens which provide additional information about open enrollment update. That's the newsletter, presentations, VBAS, medical and prescription, and you can find a lot of tools for each of the lines of coverage below there. Most of our people attending these are active employees, and so you would click on here under medical and prescription active employees, and then you'll see additional tabs with a wealth of information included in your open enrollment packet for additional information here as well. If you go back to our main screen, well, later on we'll be talking about these plan cost calculators, and those are where you can see them. I'm going to return back to the PowerPoint presentation. In just a minute. And we should be back to the open enrollment presentation here on the screen now. And here's just additional of the subpages available to you in the open enrollment page. Throughout the open enrollment process, you will make your elections at vbas.com. Once you log into that screen, you'll update your demographic information, and we will send any changes we receive directly to your districts. You're going to elect your medical plan, complete information about certification of coordination of benefits if you're a full-time active employee. Part-time employees may add medical, dental, and vision at this time. If you're covered through our program with life insurance, you may also purchase additional life insurance coverage for yourself. Your username will follow this format: BSSP, then the last 4 numbers of your Social Security number, the 4-digit birth year and the first letter of your first name, and the first letter of your last name. Your password is the last 4 digits of your Social Security number plus your 4-digit birth year. And that is the format that will be followed for everybody. If you have questions about how to do that and you're not able to log in, you can email my office again and we can assist you with that. Once you log into the system, it will ask you to reset your password to a secure password, and go ahead and do that. If you forget what that password is, just email my office and we can reset that for you. It's really critical that everybody completes their information in the portal by May 31st at 11:59 p.m. At that point, the portal will close and your opportunity to make open enrollment elections and your plan choice for July 1, 2014 will close. We'll talk about it a little bit more in just a few minutes, but I want to remind everybody that all of the current plans are terminating. So in the past, where if you failed to make elections during open enrollment, at the worst case you just continued where you are, if that is to happen this year, your district or bargaining unit will select a plan for you on a group-wide basis, and all people who didn't make an active election will be moved to that plan for the next 12 months. And this is just a screenshot of what you'll see at vbas.com. Again, you'll input your username and your password right there. Let's talk a little bit about dental, vision, and life before we dive down deep into the medical plans. On the dental plans, we have no benefit changes. We were projecting a 7% claim increase, but with rate stabilization funds and excess reserves, we reduced that down to a 4% rate increase. On the vision plan, we have no benefit changes or rate increases. On the life plan, effective last week, our board made a decision to change carriers. At the employee level, all current elections will be grandfathered into the new carrier called the Hartford, and there is no increase in your rate for optional employee coverage. There is a slight increase in the employer rate for the group term $10,000 or $50,000 benefit provided by the district, but no impact on the employee level. I'm going to pause here for a minute and see if anybody has questions about dental, vision, or life before we move forward. You can either chat them or press *6 to unmute your phone. So I don't see anything coming up, so we'll continue. Actually, we're going to talk a few minutes more about optional life. During this open enrollment period, if you have optional life insurance, you can purchase additional coverage. Your minimum initial purchase, if you don't have any optional life coverage right now and you just have the district portion, is a minimum of $20,000 for yourself, 10 of which is subject to evidence of insurability. And for your spouse, you must purchase a minimum of 10, 5 of which is subject to evidence of insurability. During this open enrollment period, if you already have optional life, you can buy an additional 10 for yourself or 5 for your spouse without any questions. Evidence of insurability is required, and that is the questionnaire you'll have to complete when your election during open enrollment exceeds $10,000 in any 1 year, or when your total optional coverage exceeds $100,000 for yourself, or when you elect more than 5 for yourself during this month of May, or that takes your spouse over $30,000. Your limit for optional coverage for yourself is limited to 5 times your basic annual earnings, or $300,000, the lesser of those two. And for your spouse, it's limited to $100,000, or 100% of your employees' total. Let's talk about medical claim trends, and this is what really drives our program. On this chart, you can see that 94% of all of our medical claims, 94% of the dollars paid out on our medical program are medical and prescription claims. Those are payments to doctors and providers and hospitals and pharmacies on behalf of members' claims, in addition to the payment a member makes themselves. In addition to that 94% going to the providers and the pharmacies, about 1% goes to Anthem and Express Scripts for administrative fees, cost to process the claims, and rent their network. 4% is used to purchase stop-loss coverage. We purchase excess coverage to protect the pool from high claims where somebody's individual claims exceed $350,000 in any 1 year. And then we have JPA as well as other administrative fees as part of that program. This chart on the right shows the real pressure within the medical industry and the JPA as a whole. And it shows the average cost of employee claims on a monthly basis, and then that solid line is the trend from July 2009 to February of 2015. And it's that increase in trends that is the real challenge for the insurance industry as a whole, including B school self-funded programs. Regardless of what the state economy does or state funding or interest rates, medical inflation is 10 to 12% per year. That means a medical claim today costs $100, and next year this time it will cost $112. And that's the pressure we feel as we have members use the plan pays out more dollars and is subject to those inflationary costs, and thus increases in rates are necessary to keep pace with the claims we're paying out. So what impacts our rates? Well, Anthem, BSP, and Delta Dental profits don't, because again, they're just a very narrow slice of our pie, maybe 1%. Members' health and frequency has a significant impact. So that's how frequently members go and use the plan. If somebody's using the plan a lot, has a lot of doctor's appointments, frequency increases, and the plan is paying more claims. Members' health and how sick people are also has a significant impact. So as more people have advanced disease states or continue along a progression with their diseases, the plan pays out more claims, and we have an increase in cost. Doctors and hospital rates also impact our rates as they charge more. It's kind of the medical inflation trend right there. We have to collect more in order to pay the members' claims. And our plans are not affected by others' claims. Our plans are only affected by our claims. So at the end of the day, we have these two factors in blue and green that we can impact. And we impact those by becoming better consumers of our medical plan. And by doing that, we become engaged. We make decisions about the cost of our care and seeking lower and free cost alternatives for our care. We utilize the nurse line. We use Anthem Compare to shop around when we have a non-emergency event coming ahead, and we utilize reference-based benefits. So we'll talk about a lot of those in a little bit. But those are tools that members have to become a partner in controlling the costs within the medical plan. As I mentioned earlier, effective June 30th, 2014, the Silver, Red, Blue, and Option 2 and HDHP plans will sunset. And we've done that because over time it became clear that the rates and the benefits between those plans have become outdated, and the relationships between plans, the difference in benefits under the red and blue and their rates, had become very, very cloudy. So it was time to come up with a new menu that we could align better. And we've done that for July 1, 2014. With the goal of better aligning the rates and the benefit differences, retiree rates and active rates had kind of gotten askew in their relationship, so we are rebalancing those. We're still continuing to provide a variety of plans to meet the needs of the population. We wanted to make sure our plans were designed to encourage the use of the Health and Wellness Center and member engagement and consumerism. We wanted to streamline the plans. We had deductibles and copayments and coinsurance, so we're working to eliminate copays under the plans. We wanted to be a partner in members' health, so we're reducing prescription drug copays for certain diseases. And we wanted to reduce future medical trends and costs and utilize rate stabilization funds. So a lot of objectives included and addressed with this new menu of plans. The plans have some expanded benefits as well. Acupuncture is now a covered benefit. It is combined with the physical therapy and chiropractic 24-visit limit. So in the current plan year, you have 25 visits for physical therapy and chiropractic. The challenge with those is that 25-visit limit is a hard stop. If you have a surgery in the fall and use up all your visits, and then you have an unplanned event in the spring requiring more physical therapy or chiro, the plan doesn't have a tool to provide that benefit to you. With this change, moving to Anthem's more standard language of 24 visits, but allowing pre-authorization for additional visits for physical therapy and chiropractic, in that scenario where you have one surgery in the fall and then you have another one in the spring, with pre-authorization, Anthem can grant additional visits. It's important to be in contact with your physical therapist or chiropractic office as you approach the higher numbers of that first limit as you're in visit 21 and 22 and 23. If it looks like you're going to need additional visits, make sure your provider is reaching out to Anthem and submitting a plan of treatment and requesting pre-authorization for additional visits. If you continue with visit 25 and 26, but pre-authorization is not granted until visit 27, 25 and 26 will not be approved retroactively. It is only on a go-forward basis. We have the Health and Wellness Center that's been online since January 30th, and we'll talk about that in a little bit. We have Live Health Online as a new benefit, and we'll talk about that in a few minutes. We also have some financial enhancements built in. Prescription drug costs prescription copayments are now included in your deductibles and out-of-pocket maximums. So previously, maybe under the red plan, we would talk about you having a $1,500 out-of-pocket maximum. With this change in structure, you now have a $1,500 out-of-pocket maximum, including prescriptions. Previously, it was $1,500 on the medical side plus prescriptions, but now prescriptions will be included under your out-of-pocket limit umbrella. We've eliminated the $25 office visit copay as well as the $250 inpatient copayment. Members on the Cedar and Dogwood plan will have a $25 copayment for non-preventative services only at the Health and Wellness Center. That doesn't mean that you don't have a cost share in office visits. Office visits are still subject to deductible and coinsurance, but we have eliminated flat $25 office visit copayment, except for at the Health and Wellness Center for the Cedar and Dogwood plan only in order to comply with IRS regulations. We are attaching a $50 enrollment and graduation incentive for those members eligible for condition care. That's a disease management program targeting those with high to moderate disease states in asthma, diabetes, heart disease, coronary artery disease, and diabetes, as well as COPD. And members eligible for that will receive a $50 incentive when they graduate and a $50 incentive reimbursement at enrollment. Live Health Online, another financial tool. We'll talk about that in a few minutes. We've reduced prescription copayments for asthma, diabetes, and heart disease medications. The CEDAR plan has a $500 or $1,000 contribution to a health savings account. We'll talk about that in a few minutes. And also we've brought in reference-based pricing, which will assist members in controlling costs for a short list of surgeries. Let's talk a little bit about the Health and Wellness Center. I hope some in the audience today have had an opportunity to visit the Health and Wellness Center and found it to be a great place for medical care. The Health and Wellness Center was opened with two goals. The first is in response to kind of a mantra throughout both the employer and employee side of our pools, stating that we've got to control medical costs. Costs were just skyrocketing, and we needed to find ways to control those costs. And so the model is that with the Health and Wellness Center and a high participation rate there, that we can provide the services there at a lower cost to the member, in this situation free or $25 under the Cedar and Dogwood plan, and a lower cost to the plan than the services you would receive at a similar urgent care or primary care physicians. All the services for those under the Alder and Birch plan are free for the Health and Wellness Center. Those under the Cedar and Dogwood plan will have a $25 copayment for non-preventative care. So under the Affordable Care Act, preventative care is free across the board at any network provider. But under that provision for the Cedar and Dogwood plans, non-preventative care has a $25 copayment. The Health and Wellness Center has extended hours, open one morning a week at 6, two other mornings a week at 7. It's open on Saturdays from 9 to 1, and open Tuesdays through Thursdays until 7 p.m. So we hope that the Health and Wellness Center hours make it convenient and accessible to our members. The second reason it was open, I got a little off track there, is to assist members in becoming healthier and well and increasing their state of wellness under our medical plan, to become a partner with members so that in the future we can actually avoid members' claims as people's diseases escalate. So with the Health and Wellness Center, we've reduced barriers of cost, we've reduced barriers of convenience, and barriers of work hours and office provider hours conflicting. There is lab services available at the Health and Wellness Center, and you can have lab services done for an outside provider. So if you want to continue to have care with another specialist or primary care physician, but they would like you to do some lab work, have them request that on a Quest lab slip and schedule an appointment at the Health and Wellness Center, and we can do your lab work here as well. We've recently opened the dispensary for the Health and Wellness Center, and you can find a list of the medications available on the Health and Wellness Center at its dispensary. I will show that screen in just a minute. At the Health and Wellness Center, at the Butte School Supplement Program's website, BSSPJPA.org, if you click on Health and Wellness Center, and then dispensary, and click here, you can see a list of the prescriptions available on site at the Health and Wellness Center. I do want to comment that the Health and Wellness Center is a dispensary, not a pharmacy. That means that they can dispense prescriptions provided by or prescribed by another physician, but you will need to come to the Health and Wellness Center, schedule an appointment with one of the providers so that they confirm that. They are not pharmacists and can't dispense prescriptions written by another provider, but they can confirm it if they agree with the diagnosis and the prescription. On the screen you can see the address. It's here in Chico near the DMV and Chico Sports Center or Chico Sports Club. We are not a drop-in clinic, and we've had some questions about that, but believe that a scheduled office appointment is the best. We do reserve same-day appointments for those waking up and not feeling well, both in the morning and the afternoon, and we'll be adjusting that based on our membership's use pattern. But we believe that scheduled appointments provide the most convenient access to the Health and Wellness Center for the majority of members. The best way to schedule an appointment is to call the 866 number on the screen, or you can call the local office as well. Any questions about the Health and Wellness Center? Press *6 to unmute your phone or type a question in the chat session. All right, you guys are a quiet group, so I'm going to continue. Live Health Online is a new product available, and members have been receiving calls this week as outreach from Anthem Blue Cross. It's actually available to you today. You don't have to wait until July 1. And it's a great complement to the concept of the Health and Wellness Center, although it's certainly not tied to that. And it's available to members across the board, covered under all of our plans. This is an opportunity for convenient care, 24 hours a day, 7 days a week, 365 days a year. And essentially it's an office visit over a video internet chat session. You log on and register at livehealthonline.com. You make a $49 visit payment that does get credited towards your deductible and coinsurance and out-of-pocket limit, but you do have a $49 cost for the visit. Once you're logged into the system, you will see a number of providers from which you can choose to have your appointment with. So they are doctors or doctors of osteopaths, which are considered equal-level providers. So essentially you're going to select one of the providers. Their bios are listed there, as well as their areas of specialty and practice and their availability in 2 or 3 minutes or at this moment. And then you'll have your doctor's appointment with them over your video chat session. So perhaps you're traveling out of the area and you don't know where an urgent care center is. You can use this to seek quality medical care over your smartphone or over an internet session. Certainly it's not applicable in every situation, but I think we can all think of kind of urgent, acute appointments. You wake up with a sinus infection, you have maybe a skin rash that's growing on one of the children, and you're not sure whether it's something that needs to be monitored or something that's fine. You can use this as a tool to decide if you need to go to the emergency room, or perhaps they can resolve your condition right there within that session and order your prescription at the nearest retail pharmacy close to you, and you can go pick up your prescription. Perhaps you wake up on a Sunday and you just really don't go well, the Health and Wellness Center is closed, and you don't want to go wait 2 or 3 hours in line at the urgent care center and not have a sense of what that cost may be. Well, for $49 you can have your office visit over your iPad and send somebody to pick up your prescriptions later that day. Any questions about the Health and Wellness Center, either with a live question or a chat? All right, I'm going to continue. Is everybody still awake? Are you guys sleepy after dinner? So reference-based benefits is a new cost containment tool within the programs, and then again, this applies to all of the plans. It is only over these surgeries on a non-emergency basis listed on the right. So hip and knee replacement, cataract removal, carpal tunnel, knee cartilage repair, knee ACL ligament repair, endoscopy, and colonoscopy. Anthem has its list of network hospitals, and we're familiar with that term. But within that, they have reached out and developed a subset of reference-based facilities. The reference-based benefits apply only to the facility costs associated with these surgeries, not to the physician. And they have contacted and capped the facility costs for these surgeries on a non-emergency basis at the reference-based benefit facilities. So by selecting one of the reference-based benefit facilities, your out-of-pocket costs will be capped. That helps save your out-of-pocket and helps save the plan as a whole. As I said at the introduction, medical care is becoming incumbent upon all of us to be good consumers and be engaged in the plan. And part of that is making sure that we use the plan efficiently and as cost effectively as possible. So if you have one of these surgeries coming up, you log into anthem.com/CA into your secure account, and under useful tools you'll find the reference-based benefits. So I would indicate that I'm having a hip replacement, and I would say I want to see all the reference-based facilities within 50 miles of my zip code. The screen will then display all of the facilities that are reference-based and what the costs are, and you would be shocked at the variability between those costs. somewhere between 5,000 and 10,000 and greater. Depending on what plan you're on, that 5,000 to 10,000 cost variance may impact your out-of-pocket. But more importantly, it impacts everybody else's out-of-pocket as we all pay the balance of the claim from the pool. So as our dollars and as our members make more efficient decisions about where they seek care, the total cost of claims goes down. Also on that website, not only will you see price differences, but you will see frequency of service, so how often they do that surgery, as well as patient outcome metrics. So some great information to help you find the best facility for your event. Any questions about reference-based benefits? Again, it's limited to these surgeries, so if you hear somebody talking about them, just remind them to check for reference-based facilities in order to control their costs and help keep everybody else's costs down as well. So let's talk about the medical plans. As you're making this decision, what is the same between the plans is that they all have the same providers and the same allowed services. So there's no change in the network. We're continuing to use the same Anthem Blue Cross PPO network, and the services remain the same with the addition of the services we talked about earlier. So a knee surgery with Dr. Smith will be provided and approved under the Dogwood plan, and the same manner it would be approved under the Alter plan and the plans in between. What's different is where you really need to focus your attention. So the monthly rate, your district is giving you a contribution towards the plan, and you have a balance of the plan or cash in lieu to consider, depending, and that's different depending on which plan you choose. You also have a different share of costs between each of the plans. So your out-of-pocket costs for a single event may be different, whether you're on the Cedar or the Dogwood plan, or the Alder or the Birch plan. And finally, Cedar and Dogwood also have some special opportunities for long-term pre-tax savings. This is a summary, a condensed version of the chart you probably received in your open enrollment packet listing our 4 new plans, Alder, Birch, Cedar, and Dogwood. Alder and Birch work in the manner of our former plans in that you have an out-of-pocket maximum per individual. You'll never exceed more than the out-of-pocket maximum for any one person or your family limit on Alder and Birch. I want to remind you that across the board on all of these plans, these out-of-pocket limits in that dark green bar now include medical and prescription benefits. So for network services and allowed prescriptions, that is your true maximum out-of-pocket. Separate limits for approved services from non-network providers do apply under the Alder and Cedar plan. Cedar and Dogwood work a little bit differently as far as the individual and family limits apply. Under Cedar and Dogwood and IRS provisions, the individual and lower limit does not apply if you have 2 or more people covered under the plan. And we'll go through an illustration of this in a few minutes. But under Cedar, if you're a single person, your out-of-pocket limit is $3,000. It says $2,500 here because that's net of the health savings account contribution down below, and we'll talk about that in a little bit. But if you are an employee and you cover a spouse, registered domestic partner, or child, or more than one of those, your limits are the higher limits shown here, and you don't have the lower individual sublimit, and that is the same for Dogwood as well. That out-of-pocket maximum line is a combination of deductibles and copay co-insurance buckets. So for example, on the Alder, you have a $500 individual deductible and a $500 copay and co-insurance out-of-pocket responsibility, which combines to your $1,000 out-of-pocket maximum. The numbers in the green bar are shown net of the health savings account contribution for the Cedar plan. So under that plan, a family has a $4,000 deductible met by one or all people under the plan, plus an additional out-of-pocket limit for co-insurance of $5,000, and that's reduced by the $1,000 HSA contribution to get us to the net of the $8,000 shown on the green out-of-pocket maximum line. Does anybody want to type any questions about what's shown on the screen, or ask any of the questions by pressing *6? continue. Prescriptions again, remember that prescriptions apply towards the out-of-pocket maximum shown on this green line. Under the Alder and Perch plans, prescriptions work in the same manner that they have previously. Okay. Alder and Birch have a $150/$450 per family out-of-pocket deductible. That is a subset of the deductible of $500 per person, $1,500 per family shown on the previous slide. So once you reach your deductible here for prescription on Alder and Birch, you are responsible for the $25, $60, or $90 copays for mail order or these retail copayments. All plans may have prescriptions filled at the Health and Wellness Center for either $4 or $8. $4 for generic, $8 for formulary prescriptions. Asthma, diabetes, and heart disease have reduced copayments of $5, $20, and $30 across the board, unless they're reduced at the Health and Wellness Center. Now, copayments under the Cedar and Dogwood plan do not apply until you have met your deductible. So back to the Cedar illustration, you have in a family, you have a $4,000 deductible. Until you have paid $4,000 out of pocket for medical and prescription combined, you pay 100% of the cost of your prescriptions. After you've reached that $4,000 medical and prescription combined, then you have these copayment amounts. How do you determine what your prescription costs are going to be? If you log into your secure account at express-scripts.com, you can see your history of prescriptions for each of your family members, the copayment associated with that prescription, which is what you have been paying, and the cost. And under Cedar and Dogwood, you would pay 100% of that cost until you had reached the deductible under each of these plans. Again, at the Health and Wellness Center, prescriptions are $4 or $8 without a much reduced price if you're able to get it there. They can dispense up to 90-day quantities within their discretion. A 90-day supply of a generic would then be $12, which is still less than your opportunities at mail order and retail. Again, it is a shorter list, so it will not be able to provide a prescription opportunity for everybody, but it does cover a very broad base of traditional generic prescriptions. Again, prescription copayments for asthma, diabetes, and heart disease once you have met your deductible is $5 for generic, $20 for formulary, and $30 for non-formulary asthma, diabetes, and heart disease prescriptions. So again, trying to reduce the cost for people in these chronic disease states, hoping to assist them with being more adherent to their medications. As they do that, total medical costs for everybody will go down as we avoid future medical claims. I see a question from Sherry regarding out-of-pocket maximums. There's only 2 people covered under her plan. So let's go back to the prior screen. As I mentioned, you'll never pay more than the individual out-of-pocket for one person. So if Sherry were to enroll in the Alder plan, she's exposed to up to $1,000 for her and $1,000 for her spouse. Her family limit then would actually be the 2 $1,000 amounts, and the $3,000 wouldn't apply. Under Cedar or Dogwood, because you don't have the sublimit, your out-of-pocket maximums are at this level. If there's 2 or more of you covered under the plan, that can be met by one person or the family in total. And we'll look at another illustration of that in just a few minutes. This chart summarizes the total potential cost under all of the plans. Alder and Birch, Cedar, and Dogwood are listed twice, once for just one person, the employee covered in the plan, and secondarily if you have a family covered under your plan. Blue is the premium amount, and the tan bars are your out-of-pocket maximums. We encourage you to draw a line at the level of your annual district contribution, so their monthly amount times 12 or 11, depending on how they have presented that information to you. The district funds everything below that, but you are responsible for everything above that. And you can see that it kind of distills down what you may have in payroll deduction for each of the different plans. Now again, in response to Sherry's question, under the Alder plan, she would have out-of-pocket maximums with 2 people of just 2 of these bars because there's only 2 people covered under the plan. But under Cedar or Dogwood, she may have out-of-pocket maximums up to this amount if they had a high volume of medical claims. We have another chat question. Do we still have co-insurance after the deductibles? So I'm going to go back to the prior screen real quick. Once you have met your deductible where you're paying first dollar up front, then you go to the second bucket. Although we've eliminated co-payments except for the ER visits, you do have co-insurance amounts. So to illustrate on the Alder plan, once you had paid $500 out-of-pocket for your deductible, you would pay 10% until your 10% had added up to another $500. And remember, these amounts are reduced by what you pay on prescriptions. So we have a tool to help you further kind of understand that. Before we go to the tool, what I caution everybody to and encourage everybody to really think about is what is your likelihood to reach the out-of-pocket maximums. Some people, this is a scary bar. This is a lot of out-of-pocket costs under the Dogwood. For a family of 2 or more people, your out-of-pocket maximum is $12,700, and that is a lot of money to anybody. But what I encourage you to really think about is what's the likelihood of that happening? Insurance is about risk. What's the risk of that happening? What's the frequency that I have that high volume of medical claims? For some people, it's never. For some people under these medical plans now, the Affordable Care Act providing for preventative care at 100% for every family member and a broad spectrum of preventative care, that might be the only time they have claims, and that's paid at 100%. So they're not going to pay anything in these tan bars for preventative care. In addition, if you're able to redirect care to the Health and Wellness Center, under Alder and Birch, care there is free, including a lab test and super low-cost prescriptions. Under Cedar and Dogwood, you do pay $25 for non-preventative visits, but that may include some of your lab work as well. So again, with those opportunities, as well as Live Health Online, there are many opportunities for greatly reduced out-of-pocket medical costs under the plan. We have some interactive plan tools to help you look at that a little bit more. We're going to go back to our web page. And these are valuable for you to kind of look at your individual pattern of claims and see how things may really look for your individual family. So to the right of our open enrollment information, you can see 3 cost calculators. The first is if you only have one BSSP plan, perhaps it's the only coverage for your family, or maybe you have some other unique coverage. The second tool is if you have double covered under BSSP. So you have his and hers. Both of you work for the same district or work for different districts, but you're both covered as employees under the school self-funded programs. And the third tool is for non-Medicare retirees. We're going to demonstrate this first one, but they all work in a very similar fashion. And it's going to take a second for that to load up. I'm going to cancel that and load a static copy so I can be sure that you can actually see it. So can everybody see a spreadsheet on my screen right now? If somebody could chat me yes, I'll know that we're making progress towards where we need to be. No, you can't see it. Okay, thank you. Let me start sharing. So now can you see a spreadsheet on the screen? Thank you. I really appreciate the feedback. So this is that first tool on our web page. And the first question, I'll try and make it big enough so that we can see the most of it, that you input information in the yellow boxes. The first question asks, how much will your district contribute on a 12-month basis towards your monthly medical contribution? If you're part-time, be sure to enter the prorated monthly contribution. So I'm going to put $758. That is a contribution from one of our districts for a bargaining unit, and you have information in your open enrollment packet about what that amount is. I do not have that information, but you can reach out to your district benefits office to determine that. The next question asks whether or not you have cash in lieu. Many of our districts do, so I'm going to say yes. That's a question about if I pick a plan below that cap, will I get money back? And answer yes if that applies to you. Now tell us about your family. I'm going to illustrate that we have 4 children in this sample family. And the next question is about whether you have other coverage. I'm going to say that is HSA compatible. HSA is a health savings account. Our Cedar and Dogwood plans are eligible for that because they are by definition high deductible health plans. If you have other coverage with a spouse through another carrier, through PG or AT&T or wherever your spouse may work, and if you don't know if it's HSA compatible, be sure to contact that plan administrator and get clarification. It's an answer they will be readily able to answer. I'm going to say that no, I don't have other non-HSA coverage. This is my only coverage in this situation. Now we're going to go down and illustrate and populate the type of claims my family has. I'm going to say that we're each going to go to the doctors at least once for an annual physical exam, and I hope that you would commit to doing that as well. Part of being a consumer under this plan is not only using the plan as efficiently as possible, but a duty to yourself and your family to make sure that you're healthy, and an annual physical exam is one way to do that. And under the Affordable Care Act, it is free for all members with network providers, so there's no out-of-pocket cost for you to go. Then we're going to see how many appointments you can attend at the Health and Wellness Center. How many times do you think you will go? And I'm going to say that we're going to take the kids there each twice, and my husband and I will each go there once. The Health and Wellness Center will see any covered member. They cannot see children under the age of 2 or women in their 3rd trimester of pregnancy. There's just too many related conditions that need to be addressed by a specialist in those situations. So now we're going to talk about office visits with other providers, chiropractic, other specialists, physical therapy, whatever your trend pattern is, and I'm just going to populate some patterns for my test family in this situation. Let's talk about emergency room visits. How frequently does somebody in your family go to the ER? I'm going to say this child's a high school athlete, and we're good for probably 1 emergency room visit per year, but I don't expect any inpatient hospital stays. So that's our pattern of claims. This is our family, and this is how my contributions work from my district. When you scroll down, you'll see the total cost of your plan and then the annual contribution towards those plans on behalf of your district. And that leaves you with the balance as a payroll deduction. Next, this is an estimate of the medical claims. This does not include prescription, but this is an estimate of the medical claims that you'll have based on that pattern of claims above for each of your members for the entire plan year. And based on each plan, the plan will make a different claim payment, leaving you with these out-of-pocket costs under each of the plans. The Cedar plan has, based on the eligibility I indicated up above, a contribution of $1,000 for this family into a health savings account, and that can be used to offset these out-of-pocket medical costs. And because my contract in this sample provides cash in lieu when I pick a plan with a monthly rate below the contribution, I get some money back as well. So this line nets all of those costs together, both my payroll deductions, my out-of-pocket payments to providers, cash in lieu into my health savings account, not cash in lieu, a contribution from the plan, not a payroll deduction into the health savings account, and cash in lieu included in my paycheck for this net amount. And then it graphs that amount out. Those numbers variable based on your district contribution, your family members, and your pattern of claims. So I encourage you to print this out. What it says is that under the Dogwood plan in that scenario, I'm going to pay the least over the course of the year. I'm not going to pay the least to providers, but I get $900 to offset that. And that brings it down to the lowest combined cost. These are kind of a flat wash, and I pay the most under the older because I have a high payroll deduction contribution towards that. So I encourage you to print that out, set that aside, and say that's probably my most realistic option or scenario. Then let's come back up and look at what happens if we work hard to get healthy and we eliminate these visits with outside providers. And we increase instead what we're going to the Health and Wellness Center with. How does that plan change? Do I get a different answer? Okay. What happens in the worst case? And the best way to show the worst case scenario is to give everybody in the family a surgery. Insurance was really intended not to help you with an occasional office visit, but to prevent financial calamity in the case that you had a significant surgery or hospitalization. And so to demonstrate that on this tool, give everybody a hospital stay and see how the different pictures present themselves. Under this, now Alder, I have out-of-pocket costs of $8,900. Under Birch, about a flat $8,000. Under Cedar, $10,000, and under Dogwood, $11,700. So this position changes based on the pattern of claims above, and you have to just decide whether you're going to live on, if life is going to present itself as it has in the past, that you have a financial plan in case you have that worst case scenario. Some people are in a different position than others in order to self-insure themselves. I see Keith has a question about where to find that spreadsheet. If you go back to our webpage at BSSP, can you see our webpage on the screen right now? It's right here on the right, Plan Comparison Calculators. And I just demonstrated this active with one BSSP plan. This is if both spouses are covered as employees under BSSP, so they both teach for Chico Unified, or one is at BCOE and one is at Butte College. This is for non-Medicare retirees. I'm going to go back to the presentation. And now we have the presentation back on the screen. And hold on for a minute, operator error. Sorry about that. Bring this back to where we were. And we're back displaying the presentation. Thank you for your patience. This is fun. All right. So again, you have that tool to help you see what your individual situation may be. As I mentioned a couple of times, the Cedar plan has some significant tax and retirement savings opportunities for those people who are poised to benefit from them. If you are exclusively enrolled in an HSA qualified coverage, so that would be our Cedar plan, you are eligible for a $1,000 family contribution or $500 individual contribution into a Wells Fargo HSA trustee account. Now that account is opened on your behalf from BSSP, and we'll put that initial contribution of $500 if you're just one person, or $1,000 if you're a family, into that account. It'll be funded 50% on July 1st and 50% on September 1st. But if you have any other non-HSA eligible coverage, you're not eligible for that contribution. So if your spouse is enrolled in the Alder plan and you take the Cedar plan, you can still enroll in the Cedar plan, but you're not eligible for the contribution because the Alder plan or Birch plan are not HSA eligible. Similarly, if you have a coverage through your spouse with another employer outside of our pool, and that coverage is not HSA eligible, you're not eligible for this contribution to the health savings account. Let's talk a little bit about health savings accounts now. Both Cedar and Dogwood are eligible for health savings accounts, but only the Cedar comes with that pre-funded amount associated with it. Health savings accounts are used to meet your deductible or out-of-pocket costs. The money that's put into there is pre-federal income, FICA, and Medicare tax. Whatever's in there gross tax deferred, and it's never taxed when it's used for qualified medical expenses. They're similar to a Section 125 plan or a 403B plan in that you tax shelter dollars for specific purposes. But unlike a Section 125 plan, there is no use or lose provision. So currently, many people that are considering Alder or Birch are spending additional time trying to analyze what their out-of-pocket costs are going to be under those plans and how much to put through the Section 125 plan, up to a maximum of $2,500 per year. But that's a stressful decision because if you defer $1,000 and only come up with $500 of qualified medical expenses, you've just forfeited the other $500. Well, with a health savings account, there is no forfeit. It is your money. You own it. It is portable with you wherever you go. If you leave the employment with the current district and go to another district, that health savings account goes with you regardless of where you go. It even goes with you at retirement. A Section 125 plan has a $2,500 annual contribution limit. For a health savings account, you can contribute up to $3,300 if there's just one person, or $6,550 if there is more than one person covered under that HSA eligible plan. Those amounts are reduced by the $500 or $1,000 contribution on behalf of the plan. And if you're over age 55, you may contribute an additional $1,000 per year as a catch-up provision. Health savings accounts can also be used for any qualified medical expense like your Section 125 plan. So maybe you're not a high medical user, but you have a child with orthodontia needs. Well, if you enroll in the Cedar plan, you just have $1,000 to help with the orthodontia cost. You may not have a Section 125 plan and a health savings account at the same time, or a 125 plan for your unreimbursed medical expenses. But you can continue with your 125 plan for child care and for premium deductions. You can use it for health insurance in between jobs, qualified long-term care premiums, Medicare premiums and out-of-pocket costs, and living expenses after age 65. So if this is something that might be an opportunity for you, perhaps you don't qualify for retirement benefits paid by the district, or perhaps the district contribution may not be enough to cover your medical costs for both you and your spouse at the time you plan to retire. This is a way, while you're working, to begin building up that savings account to help fund your out-of-pocket medical costs and on a pre-tax basis. Again, anything you pull out of that account is always pre-tax as long as it's for qualified medical expenses. And on our webpage, you can find a list of those expenses. If you reach at age 65 and you still have dollars in that account, you can withdraw them without penalty, but they'll be subject to ordinary income tax. If you enroll in the health savings account and the Cedar plan has an automatic enrollment into it unless you're not eligible, you will receive an introductory packet and debit card to your account late June from Wells Fargo Bank. And you will access that account with a debit card or from online bill pay through Wells Fargo Bank. Under the Dogwood plan, you're eligible for a health savings account, and contact your employer to see if you're restricted to Wells Fargo Bank or if they will accept another account as bank as trustee for your health savings account. So there's multiple ways to access your funds there. No longer do you have to submit receipts to have them reimbursed like you do through American Fidelity or other traditional Section 125 plans. Here, this is your account and you manage it. If your balances grow, you can invest them, and if you get to certain levels, the monthly $375 account fee is waived. And you can also invest those funds in some other investment opportunities. If you have other questions about a health savings account, you're welcome to type them now. Last night we did have a webinar with Wells Fargo Bank, and you can access that at the bsspjpa.org webpage. Go to Open Enrollment Information and then Presentations, and at the bottom of that screen you'll see information, a link to the Wells Fargo webinar that we had last night. Let me see if there's any other questions about health savings account before I go. Either type them in or press *6 to unmute your phone. All right, I don't see any of them. If not, we'll answer them at the end. This is just a summary of how over a couple of years' time one can build up an account in their health savings account and then use that perhaps in the future. You do have one of those really high medical cost years. It's a way to build up that balance to address that out-of-pocket cost in the future. I should comment that in addition to opening up an health savings accounts and the no use or lose provisions, let's say you try it for a year, and at the end of this coming plan year you develop a chronic condition or something happens and your family is going to incur a lot of medical costs in the subsequent plan year, and you just don't feel Cedar or Dogwood are the right plans for you anymore, but you still have $900 left in your health savings account at the end of this first plan year. You can use those dollars for qualified medical expenses under Burt or Alder in the subsequent years. You've lost the opportunity to make additional contributions to the plan, so you can only make contributions to a health savings account when you're covered exclusively by an HSA eligible plan. But even when you're not covered by that type of a plan in the future, you may continue to access your funds. Your funds are not frozen, and they are eligible for any out-of-pocket qualified medical expense. Let's talk about phantom coordination of benefits. This is mandatory information required for full-time employees and will pop up in the VBAS portal once you have completed your first medical plan election. So there's going to be 9 first questions. There's actually 12 different questions or radio buttons to select from situations that represent your position. And you're going to make the first selection that represents your situation. So if I am retired, and so I shouldn't have been prompted to the screen, or if effective July 1st I'm retiring, I would check the box number next to number 4. And that, once I've selected one of the first 9, if that situation applies to you, you don't need to do anything else. There's no employer certification. There's no consequence to your spouse's medical coverage. 1 through 9 are the short answers to this questionnaire. If 1 through 9 doesn't apply to you, though, you come to number 10. And number 10 says, my spouse or registered domestic partner cannot purchase coverage through his or her employer for a payroll deduction of less than $150 a month. So this tells us you have a spouse, and that spouse works at an employer's office that provides medical care or doesn't, but whatever the situation is, your spouse cannot get medical coverage through his or her employer for less than $150 a month. If they were to enroll for just themselves, it would cost $150 a month or more. If that's the situation, click on the certification number 1 in that screen. It'll pop up this form, print it out, have your spouse take it to their employer. You can't see that screen. Let me see if I can get it to show. Anyways, there's a certification form to have your spouse's employer complete that. That form needs to get back to your district office by mid-June, and if not, your spouse will be moved to the Dogwood plan even if you have enrolled in one of the other 3 plans. So make sure you get it to your district employer by the middle of June. If you're having trouble getting that from your spouse's employer, make sure you're in contact with your district's benefits office so that they are aware and they can give you some alternatives if the employer is not responding. If that's not the situation, and perhaps number 11 reflects your situation, and there you'll tell us that your spouse or registered domestic partner is already enrolled in coverage through their employer or is committing to enroll at their next open enrollment period in a plan through their employer. In that situation, you would print out certification number 2, which looks like this. I think I'm going to find a way to share that. Hold on for just a minute so you can see what it looks like. And I'm not. So we're going to go back to the presentation. In any event, you can print out those certifications from the VBAS system, or they are available online at our webpage to have your employer certification completed. Again, if your spouse can't get that from their employer, they're not cooperating, be in touch with your district office. In either of these situations, if it's not received by late June, your spouse will be moved to the Dogwood plan regardless of what plan you have chosen. If we finally get the paperwork in September, we will move your spouse back to your elected plan, but not retroactively. It would be first of the next month. Any questions about certification of coordination of benefits? For those of you who are double covered in our pool, there is a provision right here, number 9, that says my spouse is also covered under a BSSP medical plan. And in that situation, answering that question is enough. We won't need additional information. All right, I don't see any questions, so I'm going to continue. Let's talk about how maximum out-of-pockets accumulate, kind of back to that chart of the different plans. For network services, each of the plans has a bucket for deductible, and that's a fixed amount depending on which plan you choose. Each plan also has a bucket of copayments and filled up with co-insurance, mostly co-insurance now since we've eliminated office visit copayments. When each of those buckets is filled, you've reached your out-of-pocket maximum, and then the plan pays 100% for prescription and medical costs from that point. Alder, Birch, and Cedar also have additional buckets for non-network providers. To be sure, if you're going into a planned surgery or something like that, that you let your physician know and the surgery center know that you will only accept services from network providers. In the case of an emergency services will be credited towards the network buckets because you can't choose the ambulance that picks you up and the hospital they take you to and the surgeon that stitches you up on an emergency basis. And remember, prescriptions are now included in these network out-of-pocket limits. How do we reach our out-of-pocket limits based on our family size? Well, this very last statement and this text at the bottom is the most important thing. You will pay no more than the individual limit on a family member until the family limit is reached. So in this situation, there are 6 family members. If I reach my out-of-pocket maximum on July 1st, I've reached 100% for me, and the plan will pay 100% after that. If my spouse reaches his out-of-pocket maximum on July 2nd under the Alder or Birch plan, now he's reached 100% and the plan pays 100% for him for the balance of the plan year. And if child 1 does that on July 3rd, we have now reached the out-of-pocket limit for each of the first of us. But we've also reached the family limit because claims are credited both to the individual and the family limit. Under Alder and Birch, the family limit is equal to 3 times the individual limit. So with 3 people reaching $1,000 out of pocket under the Alder plan, I've also reached the family limit of $3,000. And the plan pays 100% for child 2, 3, and 4 for the balance of the plan year, even though they have not reached their individual out-of-pocket limit. Any questions about that? Now that is on the Alder and the Birch plan. All right, Let's continue to Cedar and Dogwood Plan. Under IRS provisions, they are structured a little bit differently. This is not a local decision. I'm going to defer and point all the fingers to Uncle Sam and the IRS on that. So under the under Dogwood and Cedar plans, if you're the only person covered, the single and lower limits apply from the grids, both in your handout and in the presentation earlier. But if you are a family, which is 2 or more people covered under the plan, those lower limits do not apply. And for any one person, you're exposed to the total family maximum out-of-pocket. So under Dogwood, the family maximum out-of-pocket is $12,700. That means if I'm enrolled in the Dogwood plan, I might pay up to $12,700 for just myself, but after that point, I've reached the family limit. If 2 of us reach only $6,350, we've still reached the family limit without reaching the individual limit, and the plan pays 100%. I should have said back here at Alder and Birch, in this scenario where there are 6 people and a $3,000 family out-of-pocket maximum, if each of the 6 of us had $500 of out-of-pocket costs, 5 people or 6 people with $500 worth of costs equals $3,000. The family limit is met before any individual limit is met, and because the family limit is met, the plan pays 100% for the entire family for the balance of the plan year. Again, under Cedar and Dogwood, the lower limits apply if there's only one covered. The higher limits apply to everybody in the family or the family in aggregate if there's 2 or more people covered under the plan. We're going to walk through a series of claims now to illustrate how the buckets get filled with claims. And this example is kind of pre-health savings account and pre-health and wellness center. So it applies perhaps in the case of a specialist, or maybe a student attending college out of the area and not able to access lower cost care at the health and wellness center. So this is a series of office visits under the Birch plan. Office visit 1, 2, and 3 were the same as office visit 4 and 5. This example also illustrates what you would see on your explanation of benefits from Anthem, although it goes horizontally rather than vertically for each claim. So the billed charges for each of these services was $200. And because I'm using a network provider, the explanation of benefits shows savings of $25 down to the allowed amount of $175. So the provider billed $200 but has agreed to write off $25 down to the allowed amount of $175. In office visit 1, 2, 3, and 4, the EOB shows that I have a deductible of $175. Remember, under the Birch plan, the deductible bucket is $800. And so in office visit 1, I put $175 in that bucket. In office 2, 3, and 4, I put another $175 for each visit. So at the end of office visit 4, I have filled that $800 bucket with $700. On this individual claim of office visit number 4, there's no balance remaining after I pay the deductible, so the plan doesn't pay anything and I pay the full $175. Now we go to office visit 5, billed at the same amount, the allowed amount is still $175. This time the deductible is only $100 on the explanation of benefits. Well, why has it changed? Remember, under the Birch plan, the deductible will hold $800, and I've already put in $700. That's $175 times 4. So there's only room for $100 more before that bucket is full. So with that, the deductible is $100 out of the total allowed amount of $175. So that still leaves $75 on the claim. So 25% coinsurance is 25% of $75 is $19. So here we're now talking about coinsurance. Coinsurance is not a percentage of a claim. It is is not about coordination of benefits with another plan. It's your payment towards a percentage of the claim. And on the Birch plan, it's 25%. So 25% of 75 is 19. Everybody else pays the balance of the claim. That's 56. And I pay $119. So $100 credited towards my deductible, and then $19 of coinsurance. So now the doctor sends me to lab, and the lab, again, this is not a health and wellness center because I would have gone to the health and wellness center for my lab work, and it would have been free under this example. But the lab amount, the allowed service is $1,350. Why is there no deductible on this claim? I'm going to answer that question for you. That's because, again, office visit 1, 2, 3, 4, I put 175, total of 700, office visit 5, 100, I've now reached the total deductible of $800. So no deductible on this claim. So we're down to just coinsurance of 25% times $1,350 is $338. The plan pays the balance, and I pay $338. Now the doctor gets the lab results and sends me to the hospital for some surgery. Doesn't matter what the hospital bills, the allowed amount is $10,000. Again, there's no deductible on the claim because I've already satisfied that obligation with earlier claims in the year. So the subtotal on the claim is $10,000 and 25% coinsurance is $2,500. But the explanation of benefits shows that I only owe $443. Well, why is that? Just like the deductible, my second bucket of coinsurance and copayments can only hold a fixed amount, and under the Birch plan that is $800. So after I put 19 in from office visit 5 and $338 from the lab work, there's only $443 remaining to fill that bucket, and then the bucket is full. So the plan pays the balance of $95.57, and I pay the $443. From that point forward, for the balance of the plan year, the plan pays 100% for my allowed medical services with network providers and my prescription costs. So I'm going to pause and see if anybody wants to type any questions with regard to that illustration. Or again, you can ask your question over the phone or a microphone on your computer by pressing *6. I know we're getting late, so we're getting near the end of the presentation. Thanks for sticking with us. Let's talk about double coverage for a little bit. If you have double medical coverage, you have the best of two plans, but not more than that, not more than the best of those two plans. So a low plan plus a high plan. The lower plan will say you owe a higher amount out of pocket, and that second plan will reduce the out-of-pocket amount to the amount that would have been your out-of-pocket if it was your only plan. So on the medical side, Alder plus Dogwood gets you to Alder for the medical plan, and it's just about which plan shows what your out-of-pocket is, but Alder picks up the difference between the two. However, for prescription benefits, we don't provide prescription when we are secondary coverage. So in the case of two spouses, one on Alder, one on Dogwood, the spouse on the Dogwood plan would be subject to prescription benefits under Dogwood, and Alder would not pick those up. That means that Alder you would pay 100% of prescription costs under that plan until you had reached the deductible, which is very high for a family, around $10,000. We do have kind of an option for opting out of coverage in those situations where one of the spouses could enroll in the Dogwood administrative fee. It has the same cost of the Dogwood plan, but doesn't tell Anthem or Express Scripts that you have secondary medical coverage. That allows you to be fully covered under the other plan chosen by your spouse. In that illustration, you could go back to Alder, and you wouldn't have the prescription under Dogwood for that one spouse. Double coverage under the Cedar plan will get you 2 HSA contributions at $1,000 each, so that is a way to receive that double benefit. Just a reminder, under prescription, again, we do not provide prescription benefits from our secondary. So if you have a spouse covered under our plan, we will back up his medical plan on the medical side, but he is not eligible for prescription benefits on ours. And we encourage you to explore the Dogwood administrative fee in situations where you have double BSSP coverage. Under the dental plan, 50% plus 50% really can equal 100%, and two vision plans combined together can equal to benefit. Just another slide about the administrative fee when permitted by your bargaining unit contract. It is not available to everyone, and VBAS will display it as an option if it is permitted to your group. Allows the secondary spouse to opt out to the lowest contribution rate without the high deductible plan impact. The secondary spouse is then primary on the spouse's coverage, and essentially you have single coverage for the family. No double sets of explanation of benefits and the like. I'm going to just make it real brief on retirees. Retirees have the option of Alder, Birch, and anybody that's covered under a retiree plan age 65 and over is automatically covered under the Assurance Plus One plan. That is a Medicare supplement that has the traditional prescription benefits of Alder and Birch. We have a separate presentation dedicated just to retirees that you can view as a video on our presentation page on our website. We still have an employee assistance plan. I really encourage people to access that. It provides 4 hour-long in-person mental health counseling sessions per person, per incident per year. So perhaps you have a stressful time at work. At one point in time, you're eligible for 4 sessions for that. And then maybe you have a very ill family member and you would like to attend some counseling sessions to deal with that as well. So that's a second incident, and you're eligible for a new bank of 4 in-person visits. It's also available to all employees, whether or not you're enrolled in the medical plan. So perhaps you have a part-time peer that's having a tough time and you think some counseling sessions would help them. Just because they don't have medical coverage under our plan, they can still access the employee assistance plan. As can all people you define as a member of your household. This is run by Magellan Health Services, and they honestly don't get a list of our covered members. You just dial their number, which is dedicated to Butte Schools. So your niece that's living with you and attending Chico State, your elderly parent, anybody you consider a part of your household, an older child that's no longer eligible for coverage under your plan, is eligible for services under the EAP. It also provides hour-long legal and financial counseling sessions as well. I just want to remind everybody about the free and low-cost services available through Butte School self-funded programs. We have a lot of opportunities. I know costs continue to escalate, but a lot of opportunities to access free, and this heading should say low-cost services throughout the plan. So many opportunities still to get great quality care. Everybody gets 100% paid preventative care. You have free care at the Health and Wellness Center, or low cost if you're on Cedar and Dogwood plans, on preventative care at the Health and Wellness Center at just $25 office visit. Lab fees are included both on the free and the $25 for Cedar and Dogwood. Low cost prescriptions, all of that type of stuff. We also have our 24/7 nurse line. That's kind of a triage nurse line on the back of your card to call. If you don't know, perhaps there's a home remedy that might avoid the need for a medical office visit. We were traveling at a family cabin up in the mountains and had a child that continued to have recurrent nosebleeds and was able to call the nurse line and get some home remedy suggestions for that and avoid the need to go to an office visit and make the child much more comfortable. Examples like that, examples about you don't know if you need to go to the doctor. 24/7 nurse line is a great way to assess whether your cold has turned into an infection that can now be treated. And nothing worse than going to the doctor and waiting to find out for your appointment and finding out that you really didn't need to go at all. So that is another great opportunity for care. I'd like to make another little plug for the Health and Wellness Center because I didn't include it in the original presentation. But the Health and Wellness Center is also a great no-risk situation. So you have no financial risk in coming, or maybe just a small $25 cost. If you don't know where to start on a path to medical wellness and health, you can start there with really no risk as opposed to maybe a wasted visit somewhere else. If they said, no, everything's great, you're just going to have to wait it out. Well, at the Health and Wellness Center, you don't have that cost barrier. I see a question from Karen. I know this isn't going to be presented again, but this is recorded, and we have another recorded presentation available at our website so people can listen to it like that. Or we have a live presentation tomorrow night. Where do you call when you have a question? Well, call your district when you have a question about when your coverage begins or ends, or you want to make changes to your coverage, or you need some information about the cost of your coverage. Call the carrier directly if you need to provide or determine who is a network provider. They also have online search tools. If you have a question about a claim status or a payment, or you don't understand your explanation of benefits, or you want to know where you are in your out-of-pocket limits, for the plan year to date. But go ahead and call our office if you're having a problem with that carrier. So we certainly encourage you to give them a shot and call them once, maybe twice, to get an explanation on something that's not sounding quite right to you. But if you're not getting the answer you need after that first 1 or 2 phone, please be sure to call my office. Typically when I'm out meeting with people, one of the saddest situations I always hear about is that somebody will come up and tell me they've been working with Anthem or Express Scripts for 2 months or 3 months trying to get a prescription or a medical claim paid, and that's about 2.5 months too long. So if it doesn't happen on the first 1 or 2 calls, please call our office. That is an integral part of the services we need to provide to members, making sure you get the benefits available to you under the plan. Well, congratulations. You've made it through an hour and a half with me chatting about the Butte Schools Health-Funded programs and your opportunities for plan elections during this open enrollment period. I want to open it up for questions. I am going to put everybody back in the opportunity to speak, so I'm going to turn you off of mute, and hopefully there's not too much background noise, or you can type your questions in the chat session.
All guests have been unmuted.
So does anybody want to ask a question over the phone? Or does anybody want to type a question in the chat session? I'm going to give us just a few more minutes here. It's 8:27. I'll stay on the line for another minute or so. I'm not seeing any additional questions. This presentation has been recorded, and we will make it available on the website in the near future. There's also a recorded presentation from Butte College. So I do have a question. Is it still possible to do the Health and Wellness Center assessments? Yes, you can call and do your health risk assessment here in-house, or we will soon be announcing a schedule for those in the summer and fall. We do ask people who intend to utilize the Health and Wellness Center to participate in a health risk assessment. That includes a fasting blood test, about a 10 or 15-minute questionnaire, and then assessment of your height, weight, and blood pressure. So quick way to get involved with the Health and Wellness Center. You can come if you haven't had a chance to do your health risk assessment for 1 to 2 office visits before completing a health risk assessment, so don't let that be a barrier to you coming to get care here. Well, do we have any other questions? Well, I don't see any. Go ahead and email me directly. My email address is here if you do have any other questions. Other than that, thank you all for joining us. I hope this was valuable for you. I wish you a good evening and take care.